Hello, I'm Martin Woodrow. I'm the Chief Executive of the British Dental Association, and here's my roundup of the key issues in dentistry this week. The big news for England this week is that the much anticipated letter from NHS England on key contractual issues was finally published. We've worked with NHS England to shape the outcomes, and there are three that I want to focus on here. First is the abatement figure, 16.75%. Second is the contractual arrangements for urgent care centres, and the third one is current conditions for NHS contracts, and I'll go through each one of those now. Going back to when dental practices in England were told by the government to cease face-to-face care as a result of the virus, the NHS reassured us that it would continue to honour contractual payments. However, it also said that it would be reducing that overall figure to take into account the costs not spent by practices during that period. This figure, the abatement, was confirmed this week to be 16.75%. Figure applies to contracts during the period the 1st of April to the 8th of June, when practices were either stopping all face-to-face care or in some cases acting as urgent care centres. For operating as an urgent dental care centre during the period, there will be zero abatement and the full contract value will be paid. And that recognises the commitment of UDCs in extraordinarily difficult times, as well as the added costs of set-up, PPE, staff, etc. From the 8th of June onwards, when practices returned to face-to-face care, 100% of the contract value will be paid with no abatement. There may be mixed views about the 16.75% figure. We think, all things being considered, it's a pretty reasonable figure. Dave Cottam, chair of the General Dental Practice Committee, details more of the background to this in his blog and explains how we worked with NHS England via frequent virtual meetings, putting forward the case for the profession. Dave's blog should answer some of your questions, so have a read of it. The link is below. Many practices will be relieved to know that during the current period you will not be measured on the delivery of units of dental activity. However, NHS England will be requesting some assurances from practices. Firstly, that you're open for face-to-face care, that you're adhering to contractual hours with reasonable staffing levels for NHS services, and thirdly, that you're performing to the highest possible level of activity, with no priority being given to private care over NHS activity. So to receive full contract value, that your practice will need to deliver at least 20% of usual volumes of patient care activity. Importantly, we've agreed with NHS England that the definition of patient care activity includes all clinical contacts with patients, and that can be face-to-face, that can be by telephone or video consultation via the COVID triage portal. There's a lot more essential detail on this on our website, and again the link is below. Just as there were conditions attached to contract payments for the period from the 25th of March, these conditions remain in place for the current period. Practices must ensure that all staff, including associates, non-clinical and others, continue to be paid at previous levels. All practices will be asked to provide assurance over their continued engagement of staff and to give an explicit declaration that they have not gained any windfall profits. We know there is some confusion about what is meant by the term paid at previous levels. Our view is that net pensionable earnings is the simplest and fairest figure for associates, but we know that there are other ways of doing it, and that should always be done by agreement. This week in Northern Ireland, we issued a stark warning in a letter to the First and Deputy First Ministers about the financial turmoil facing dental practices. We issued a plea to the Northern Ireland Executive to provide additional support for dentistry. We have persistently highlighted the lack of funding for practices with a mixed private element, as well as the urgent need to improve funding for the GDS budget in order to safeguard NHS dentistry. BDA representatives have followed up our political action by highlighting these concerns across the media this week. Following a 1-hour programme dedicated to dentistry issues, including the lack of central supply of level 2 PPE, we've now seen a U-turn by the Health and Social Care Board on urgent dental care centres. UDCs will now remain open until the end of August. This is welcome news, but for this campaign to really be successful, we're calling on you, our members in Northern Ireland, to join with us and take action. We ask that you share your stories of how COVID-19 has affected your practice financially with your members of the Assembly, and urge them to write to the First and Deputy Minister on your behalf. If you follow the link below, you'll see a box. Drop your postcode in it and it will list all of your MLAs. Select them and you can send them your message. As you know, we've all been anticipating a report into fallow and ventilation downtime, with primary research being undertaken by National Services Scotland. We understand that research has now been concluded, but we're still to see the results in the public domain. We also know that the Scottish Dental Clinical Effectiveness Programme, or SDCEP, has been reviewing aerosol generating procedures, including what defines an AGP in dentistry and much more besides. This later piece of work includes a massive literature review, which is incredibly involved and is still a few weeks away. Hopefully we'll have something to share in this area soon. We know how important this issue is. Indeed, in the return to practice survey that we ran this week, 95% of practice owners across the UK indicated that it was a significant barrier to increasing activity. So we're going to keep on raising the issue, and we'll report back to you when we have anything more to share. In Scotland this week, we reiterated our dissatisfaction with the government's lack of engagement on recent developments in a letter to the Chief Dental Officer, Tom Ferris. We did have a constructive meeting with the CDO and his team later this week, looking at how we can work together and negotiate more effectively in the future, and more on that soon. Also this week, we have a blog from a dentist in Glasgow on his experience being redeployed to an urgent dental care centre and how the centres are evolving as lockdown eases. Have a read of that, the link again is below. Well, that's all from me this week. I'll be back next week with more news and updates. In the meantime, have a safe and healthy weekend.